electrocardiogram. So when we want to look at the actual physiology of the heart generates its own conduction, right? So it's its own action potential. Remember how we talked about how the heart is an autorhythmic type of muscle, so cardiac muscle is autorhythmic, and these cardiomyocytes generate their own form of conduction within the heart, right? And so the way we monitor this conduction is through a technology called electrocardiogram. It's abbreviated ECG. It's also known as EKG. I don't know where that name came from. If you can spell it, cardio is with a C, but they put a K in there. I don't know, maybe it sounds better. Maybe Hollywood tried to take over and do something unordinary. Anyway, so each electrocardiogram have their own specific sinus rhythm. So if we talk about the sinus rhythm here, this is measuring the specific conduction pathways of the different regions of the heart, right? So the way we've seen this before is this little rhythm here. And this rhythm is labeled the PQRS T complex, right? And what happens at each of these specific regions is there is certain measurement of conduction that's taking place in the heart, right? So if we go step by step at number 1, so at the P region here. P region, this is atrial depolarization. So whenever you see depolarization, always think about contraction. It's another way of saying contraction. So this is where the atrium begins to contract, right, in order to eject most of the blood to go into the ventricles. The QRST complex, QRS region, this is coined ventricular depolarization, right? And again, as I said before, this is indicating contraction. So there's contraction that's taking place in the ventricles of the heart, right? Another phenomenon that happens in the QRS that's not really coined majority of the time is you have atrial repolarization. So if I write that in yellow, atrial repolarization. And this is basically relaxations in the atrium, right? And the third and final thing here is the T complex that we see, and the T complex is where we have ventricular repolarization. So as we said before, repolarization indicating relaxation. So this is where the ventricle relaxes. So what are these used for? What is this electrocardiogram used for? Okay, so electrocardiogram is used to indicate any kind of blockage of conduction. So instances of cardiomyopathies, myocardial infarctions, ischemic related conditions involving the vascular system, involving the actual specifically the heart, can be measured with the electrocardiogram, right? So everyone has panic attacks, right? And sometimes you have these pains in the left side of your chest, and you're realizing, oh no, I'm having a heart attack. Is this a heart attack? Well, you know, if you want to spend insurance money, which is fine, right? So take advantage of the insurance as much as possible. Go to the doctor, tell him you're having a heart attack. You know, if the doctor was a good doctor, he'd automatically assume that you're having a panic attack, and it's not necessarily an instance of myocardial infarction. But because the money was coming in and the insurance covers everything, they put you on an ECG, and they monitored your conduction of each sinus rhythm that's taking place. And that any kind of changes in this would indicate some kind of myocardial infarctions, right? And so this technology is a great way of detecting abnormalities of the heart.